Welcome to Health Professional Radio. I'm your host, Neil Howard, and I'm glad that you're here. In this segment, we're going to have a conversation with Dr. Eric Brouwer. He's joining us here as Chief Scientific Officer at SQI Diagnostics. Now, SQI is a company that's focused on the science of lung health. Dr. Brouwer is joining us to discuss the development and manufacture of respiratory health and precision medicine tests. Welcome to Health Professional Radio. Dr. Brouwer, thank you for joining us.
Thank you.
Well, I understand that you've got quite a bit of experience in researching and developing medical devices and diagnostic products. Give us a bit of your background and tell us what it was that drew you into the field of research and development.
Yeah, thanks. I have a Ph.D. in physical chemistry, and I was on track for an academic career and just fell into diagnostic, purely accidental. And I was absolutely hooked by the opportunity to develop products and technologies that made a difference in patient lives. And so I had an opportunity to join a startup company, and that was eventually acquired by Abbott Labs. And throughout my career, I've been able to interact with patients who've been able to share with me how the technology that I've been part of have saved their lives, made a big difference in their own lives and lives of their families. So it's been an incredible opportunity and a privilege to be part of that. So hugely motivating for me to make a difference in people's lives.
SQI is, as I said, focused on the science of lung health. SQI has been involved in pretty much all the aspects of COVID-19 testing, rapid PCR, antigen, antibody testing that was recently approved by the New York State Department of Health. Give us a little insight into this recently approved antibody test and talk about the value that it provides for both health professionals and consumers as well.
Our motto is lung health is human health, as mentioned, and we do the development of diagnostics for precision medicine. Our antibody test is a test that measures levels of antibodies to the virus that causes COVID. And there's three types of antibodies that the body produces in response to the virus or the vaccine. And we measure all three, the IgA, IgM, and IgG. And each of them gives a piece of information about the body's immune response to the virus. In addition, we look at those antibodies that are responding to the spiky bit of the virus itself and then the central ball of that virus. So it gives us a really comprehensive view of the immune system responses, in essence, 6 results to see what the body is doing in response to COVID or the vaccine. So what does this tell us? For consumers, this gives us a snapshot of what antibodies you may have at any given time, and also the level of these antibodies. Do you have them, yes or no? And if so, what levels are they? With some serial testing and sequential testing, we can actually see what's happening with time. Are these antibodies going up? Are they going down? It gives you a snapshot of you as an individual, but also your healthcare provider, your vulnerability, the effectiveness of the vaccine, and at a large scale, from a public health perspective, being able to take this data, de-identified, of course, and aggregated with other things such as vaccination records and local rates of PCR positive, to give us a sense of population vulnerability. Hugely valuable for like workplace assessments, long-term surveillance, and I think also this is so new. The science is so new. So be part of the diagnostic that helps us manage from a pandemic to endemic and eventually winning over the COVID pandemic.
Now, I do want to get back to some of the effects that COVID-19 does have on the lungs. But before that, COVID-19 lung effects aren't the only aspects of lung health that you're involved in. Talk a bit about how you're involved in making sure that lung transplants are more successful.
Yeah, so prior to the pandemic, this was our primary focus of being able to apply precision medicine diagnostics into lung transplant. And entering into this field, most people don't know that about 70 to 75% of available lungs are rejected for transplant. They're just not used. And so we've been looking at technologies and diagnostics that give us insight into the status of the lung as it's being transplanted and what the outcome for the recipient will be. And we partnered with University Health Network in Toronto, one of the leaders in transplant. And these markers allow us to essentially take that 20 5 to 30% utility of lungs and push that up well above 50. We're looking to push it as high as 80%, because right now the surgical teams just take a look at the lungs and assess their suitability from a number of qualitative assessments, color, swelling, etc. And what we're able to do is to bring precision diagnostics to give us some insight about the biomarkers that are related to inflammation. So we're very excited about the opportunity to play into that with this diagnostics technology. When COVID hit, we saw two things happening in the transplant space. The number of donors dropped, and the number of recipients or people needing transplant went up. And last year, NBC just gave a news piece at the middle of April indicating that 10% of all transplant recipients from last year, 2021, were COVID patients. So we're really seeing how COVID's impacting, long-term COVID is impacting the transplant space and is making lung transplant and those technologies all the more relevant as we deal with the long-term consequences of COVID-19.
As far as COVID-19 is concerned, do these tests more accurately determine who is a candidate for a COVID-related lung transplant as opposed to, if they've got COVID and it's at this level, they definitely need a transplant. Now, maybe we can let them keep their lungs because of this, that, or the other thing.
Yeah, definitely the number of COVID assessments and testing throughout the process of transplant. First of all, on the donor lungs to make sure that, they haven't had COVID or, haven't had effects of that. But primarily the testing allows us to drive through with a healthy lung into a recipient that would be able to have a very successful transplant, have a very short length of stay in the ICU post-transplant, and a rapid return to health with that technology.
This approval, what impact do you think it'll have on the future of your work in this industry specifically?
Yeah, I'd say overall, like the pandemic and the diagnostic testing, there's never been a point in history where so many people have tested at home. So there's been a long-term decentralization trend of testing moving from, the central lab in the hospital and moving to more accessible to consumers and patients, and definitely the pandemic has accelerated that. And furthermore, we've seen a lot more, accessing video services, et cetera. So that technology has surged, digital access, and we've seen new technologies such as non-invasive breath diagnostics coming to play. So it's really, the COVID pandemic has really transformed the diagnostics and healthcare. And I think for a very, very good outcome for recipients and consumers and patients. We partnered with a company called Allstone Medical to apply non-invasive breath analysis to lung transplant recipients, using some of this new technology to replace invasive protocols with biopsies post-transplant. So a lot of these technologies and decentralization makes it very exciting for me as a CSO for a diagnostic company. Very excited about the future.
Eric, give us a website where we can learn more about SQI Diagnostics.
Yeah, www.sqidiagnostics.com.
It's been a pleasure speaking with you. Thank you so much for giving us some of your time this morning, and hoping you'll come back.
My pleasure. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Eric Brouwer. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.